Care after tooth extraction. Tooth extraction is one of the most commonly carried out procedures in any dental office. Patients who are getting tooth extraction done are more skeptical about the healing after taking out a tooth. In this video, I'll discuss how to take care of your mouth after getting a tooth extraction. Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. To remove a tooth, there can be many reasons. Maybe you have a very deep cavity which cannot be filled up. Maybe you have lost a lot of bone around the tooth and your tooth is moving. Maybe you have an extra tooth which has to be removed. Maybe there is some disease process around the tooth due to which you have to get it removed. While tooth extractions, when undertaken by an oral surgeon, is a very smooth procedure, and during the procedure there is rarely any chance that you are going to have any kind of intraoperative complication. It is the period after extraction where the patient has to be very careful about what they are doing and what they are not doing. So let's start with the first phase after tooth extraction, which is the immediate few hours after extraction. What do you need to do? The first thing is you will be most likely released with either a piece of cotton or a piece of gauze put over the area where the tooth was extracted from, and you would be asked to bite on it for at least an hour. This is very important as this is the time period where the clot, blood clot that is forming after the tooth has been extracted is still maturing. The clot is not mature within minutes. It takes at least 45 minutes for the clot to be very mature so that any forces which try to remove the clot then are unable to do so, and we are sure that the clot has now formed and the bleeding from the socket is very unlikely. The second is whether you can spit or not. Well, spitting on the first day of extraction is a big no, and the main reason behind not being allowed to spit is also related to the fact that spitting can cause dislodgement of the blood clot that we want, and hence spitting is not allowed. For the same reason of not wanting dislodgement of the blood clot, even drinking from a straw on the first day of extraction is not allowed. Well, the next thing is what can you eat or not eat on the day that your tooth is extracted. Well, it is advisable that for that 1 hour that you have the cotton in your mouth and you're biting on it and you're allowing the clot to mature, during that time you should not consume any liquid or solid. For the rest of the day, it is advisable that you take something that is at least of room temperature, if not lower, and something soft. Brushing and rinsing for the rest of the day is also not allowed, again for the reason that we don't want any clot dislodgement. From the next day onwards, you can start your normal activities of brushing, rinsing, spitting if you want. You can go back to having warm and hot foods, hot beverages. What is most important from the second day onwards is that you do warm water salt rinses so that there is an antibacterial effect in the mouth. The warm temperature also ensures that we are re-establishing the circulation which we tried to bring down on the previous day to prevent any bleeding episodes. We also want to keep the mouth very clean from the second day onwards, hence brushing and mouth rinsing must resume. The last segment which I want to cover is, can you have alcohol or smoke tobacco after a tooth extraction? Smoking is a complete no. Nicotine and tobacco and its other contents are known to impede the healing of a tooth socket. They are known to cause higher rates of dry socket and delayed healing and even post-operative infection. So at least for a week there should be absolutely no smoking. Alcohol has interaction with a lot of commonly prescribed drugs after tooth extraction, hence do ask the doctor before consuming any alcohol after a tooth extraction. If there are still doubts left and you just got your tooth extracted, please leave it on the toilet.